वेलकम बैक टू माय चैनल रेमेडिया होम्योपैथी का। मैं आपका मेंटोर डॉक्टर सौजन्य मौर्य लेकर आया हूँ आपके लिए आज कुछ नया। आज हम जानेंगे डिस्पेंसिंग ऑफ द रेमेडी। Dispensing of the remedy. In the routine mode of administering drug beside their violent and injurious action on healthy organs and the utter uncertainty of their curative effects. Everyone can testify as to digest and nausea invariable excited in the individual doomed to be subject of their influence, and especially in this case in children and delicate female, who indeed constitute the great majority of medicine takers, who, without a shudder, can be contemplated the powders, the drops, the pills, the draught in the thousand nausea forms, causing the poor patient to dread the arrival of the moment when he is to swallow them, even though he believe they are restored him to health. Add to this painful consequences ever attended on taking these health destroyer doses, the reaching and straining caused by emetics, the gripping by the purgatives, the salivation, emaciation by mercury, lassitude, fainting and weakness caused by the leech or lancet, the smarting, burning intolerance, itching produced by blister, running sores by the sentons, the torments by caustics. Nor is that all. Still greater torture is reserved for the poor patient, who may unfortunately afflicted with the disease of the chest or spine, for which moxa and red hot iron is applied. It would be easy draw and write a faithful picture of consequences result from the medicinal and other curative means restored by the common practice. That, however, is not my object. It is sufficient for many purposes to show that by the rational and scientific doctrine he recommended the human race will be delivered from the torment of such cruel, unnecessary and dangerous treatment. In its vast resource, homeopathy is not restricted to the immutable law which direct the choice of the curative, neither is it restricted in the immense materia medica from which to select independently of these great advantages. It is possess other which arise from mode of preparation of the medicine and from exactly minor dose which they can be prescribed, thus whole exempting the patient from the dread consequences we have just detailed, combining the old prescription as an advantage no small importance. The supersedes and consequently abolishes bloodletting, whether by the lancet, by cupping, or by leech, as well as employment of blister, cauterials, selton, moxie, and every other process which produce pain, debility. It is abolished also pill, drug, and digest poisons. The homeopathy physician, in the place of these substance dose of medicine, minor, tasteless but effectuous, in efficacy indeed, over disease for the suppressing the violent means, enumerated above, and so minor and tasteless that may be administered to the youngest infant without exciting repugnance. Those do not concede the compound of medicine, for the homeopathy principle does not admit of them. They invariably contain but one simple ingredient, and they are all as I have solved in my first work, reduce the liquid state to an alcoholic tinctures. In this state, medicine may be administered, giving the patient either a single drop of pure tincture and diluting the drop in a certain quantity 2, 4, 8 or 12 ounce of the water. This way to giving of homeopathy medicine is frequently employed, but it is seldom happen that an entire drop of tinctures, even in the highest dilution, as the 24th and 13th in dispense at one time, because experience daily prove that this is too strong a dose when correctly chosen. The method of giving homeopathy medicine are most generally pursued is that of dispense in globules. This consists of sugar and starch substance without medicine property and perfectly calculated to absorb the alcoholic tinctures to retain for the year in the medicinal properties impart up to them. These minute bodies are about the size of poppy seeds and administered according to the greater and lesser susceptibility of the patient. These being generally considered the maximum quantity. It will be observed that by mean of these globules, it is easy to divide a drop of tinctures very minutely, and therefore no more need to be given than the fraction indeed. Moreover, as we possess the various dilution or degree of strength in the tincture, we also possess the globules imbibed with these different attention. The globules are usually given in a very small quantity of sugar of milk, which contains no medicinal properties. These dry powder is either taken on the tongue and dissolved in a little clear water and take at once or at a started time as the physician may see necessary. Should the globules thus dissolve in the required to last several days, it will be necessary in order to keep the fresh water to add a few drops of the pure alcohol or still better on two small pieces of the charcoal after having first washed them thoroughly. According as Dr. Carl Julius Egidi was the first to discover or at least to announce the advantage of dissolving the medicament in water, it is but justice to him that his name should be attached to importance to improvement which enable us to gratitude the strength of a remedy at pleasure and to repeat those of as we think proper by observing the effect which arise. In acute disease, the most inestimable effects are by the means produced and the chronic disease by repeating the remedy every day in a very small fraction doses regularly continued we obtain the most speedy cure. This cure is seldom delayed by the strong aggravation which induce the necessity of suspending the treatment or of having recourse into antidotes. There are also circumstances under which curative may be administered by the smell. For this purpose, the patient places the phial containing the suitable remedy under his nostril and inspire the aura several times. The applying of them exteriorly to affect part has hitherto been but rarely restored to, having been almost entire conflicted to earning of which of the tincture mixed with the water. It is used to relieve the contusion, wounds and cut, and to the oil of turpentine used to cure the scald and burn. But it is possible to analogy may induce the practitioner to try other useful medicine application to the skin. In case of the local and external disease, taking care at the same time giving the internal remedy. Footnote: when the use of magnet in disease as bar is taken from the 8 to 18-inch long, each end having a attractive power of about 2 ounces, after which having a choose the end best suited to symptoms. It is put in the contact is nearly in contact for 1 minute only with the part affected or with the extremely of one of the patient's finger. What is the proper dose to be dispensed of curative? What is the best dilution? And which among those we have named is the preferable manner of dispensing it? A very important question. In general, the curative should be administered in a very minor dose, 1, 2, or 3 globules, according to susceptibility of the patient. It will seldom occur that a larger dose will to be required. As to faintest dilution, I shall state a few particles on that subject. When I treat a repeated dose and shall a present merely observe that the grand point is to make choice of a good remedy because it will be effect the cure at any degree of dilution. If small instead of the large dilution are usually done to avoid too strong aspiration of remedy. The cure is similarly accomplished when the dilution is low, as I have very often witnessed in my own practice. As to mode of dispensing the curate, we may safely say that all are good, and that hitherto practice has not determined which is the best. The ground object, as our lady said, is to the chosen the right remedy for when it will chosen. It will cure in the state of dilute tincture, in the state of glucose mixture with sugar, in the state of the glucose dissolved in water, and finally sensitive patient when expired by smelling. The more liable a patient is impressed, the more and medicine should be divided in consequently that method which most facilities that division should be adopted. Smelling therefore should be had recourse to in the case of a person of so much sensible that the slightest medical action would be painful. Patient less adopted to impression should take the globule dissolved in the water. A portion only of the solution begin given at once time. Other patients still less sensible may take a globules dry or sugar of milk to the number of 2, 3 and 4. Those, on the other hand, who are far less susceptible or impression under the influence of medicine may take them in the tincture, but already point out there are very few persons, very few cases which will require or will be such as strong homeopathy doses. The dilution made use of by them homeopathy physician are the millionth and billionth and quadrillionth, octillionth and delillionth. I am perfectly aware the physicians who have exceeded and lessened these proportions, but generally speaking, these is not only useless but improper, since the above produce effect quite powerful enough. But it is a time to treat that most interesting subject, the repetition of the doses.